I once asked myself what I would like to leave to the world in my lifetime. More than 200,000 years ago, humans were born. 350 years ago, we saw the world for the first time. 100 years later, we learned that it was the enemy that caused people to die more than the war. We then came up with the most powerful drug, the most powerful weapon we didn't know. That the magic bullet that saved the lives of many. People, if misused, would cause the disease to become stronger and develop itself into a disease, turning it into a global problem. Diseases are becoming more and more familiar to us. Both bacteria, viruses, and various species. They are everywhere, spreading everywhere. The most dreadful pathogen is bats.
We go back to the day we encountered antibiotics. We thought we had conquered the disease and caused everyone to dabble in heart disease medicine, blood pressure, diabetes, and sustained-release drugs. Me too. Because it will be a new disease that Thailand is aware of for the first time, people are afraid that they will be infected and die from other diseases because it is an immune deficiency disease. In that crisis, I revisited myself as a pharmacist. What will I do for the Thai nation? I believe prevention is better than cure. Because prevention will reduce the loss of both the healthcare system. So I started to study the guidelines from WHO and CDC. I decided to prevent all pathogens and all the part way. That day, I found the answer to our existence. PHISIT Healthcare. At first we choose the hospital because it is a high-risk area for infection. We produce disinfectant in hospitals to protect healthcare worker, patients, and relatives. Hospital areas must be sterile and safe. What ways can germs be spread? First, it's spread through the air, such as TB and COVID-19. Second, from hands. The CDC specifies that you have to wash and clean of your hands first. There are two ways to wash your hands. One is hand washing with soap and water. Second, wash your hands without water. We are the first to make alcohol gel in Thailand since 1993. And the third, the spread of germs must be on surfaces, atmosphere, tables, bed cabinets, as well as clothes and medical equipment. PHISIT will find pain points or gaps in the product, such as odor, corrosion, instability, and we developed a stable product. Reduce the smell so it doesn't have odor or a bad smell, and does not corrode. Studying that cationic products, they are non-toxic to human cells and they only destroy bacteria and viruses. These advantages have led us to develop cationic disinfectants and synergistic products that help cationic disinfectants. As we study the plasmid of MDROs, it is difficult to destroy. Even dead pathogens can also transmit drug-resistant plasmids to non-drug-resistant pathogens until becoming a drug-resistant infection, especially it is hidden under the biofilm. When we know that biofilms are a breeding ground for pathogens, whether live pathogens or bacterial remains, making enzymatic detergent to remove biofilm. And pathogens, while enzymatic detergent cleans medical devices like new. The enzyme penetrates hollow instruments, uneven surfaces, and crevices. It removes the biofilm. Pathogens never stop developing. Myself must not stop too, so we have to find help so we can do. PHISIT Intelligence.
PHISIT is a production high-quality products company which is a defensive. The setting to raise the level to PHISIT Intelligence company to create a platform to prevent pathogens. Platform that we do to create benefits. The first one is prevent infection in the hospital. The second is to reduce imports, which causes money to flow out of the country to buy foreign systems. The third, it promotes the stability of information on the Thai public health system. And the fourth point reinforces that Thai companies can develop on a par with foreign countries, and most importantly, I think we can develop better to be more in line with the context that hospitals in Thailand can use to achieve comprehensive and sustainable efficiency. Implementation of the platform into our products of POS Healthcare, it allows us to go beyond the transdisciplinary of plants and animals without limitations.
This is the first time we step out of the hospital, transcending science to the point where drug-resistant contamination is a new dimension in how we prevent drug-resistant infections on a broader scale. Solve problems with understanding. We approach farmers, offer safe alternatives. We are expert preventer. We invent infection prevention and control products. When combined with the application, the benefits are maximized. Get quality products that can be exported all over the world. Vision of POS is that we would like to see fewer infected patients. We want to protect humans, plants, and animals from pathogens by world-class products and world-class technology. Because good health and well-being is the path to true sustainability.
Even though the dream is far away, even though we are a Thai company, growing up with Thai researchers, Thai institutions, but I believe that if we work together, walk with the goal, we must go to the Thai flag and declare that we are one of the protectors of the world for all people.
Welcome pharmacist Dr. PHISIT UIRUNGROJ.